particular day's session with Dr. Reza. So thank you very much, Dr. Reza, for being a wonderful coach for me. So we also have, as I mentioned, five wonderful speakers for today. Dr. Garg, thank you very much. You have chosen such wonderful speakers who are going to not only give their experiences, but also contribute to this integrative thinking. I am very confident after reading their bios on one side and also their abstracts on the other side. So let us start the session by introducing the first speaker who has done lots of work in the field of healthcare, Marc Pelletier. Dr. Marc Pelletier is CEO of the Institute for Health System Transformation and Sustainability, based in British Columbia. As a not-for-profit independent think tank, the IHSTS is laser focused on leading system-wide improvement in two areas. Number one, palliative care and type 2 diabetes. So prior to this role, Marc was a senior strategic advisor with BC's Ministry of Health, developing a virtual care strategy for BC. In his 20-year career in Fraser Health Authority in British Columbia and its predecessor organizations, Marc led a very broad range of clinical and support services. Marc has master's degrees in criminology and in health administration, both from University of Toronto. More than anything, the topic of discussion today, what Marc is going to give us, which is very, very interesting. So because we all worry in even telling that you can use various interventional modalities for treating a condition, but Marc has chosen reversing a disease, the possibility of reversing a disease, particularly bringing type 2 diabetes to the focus as the topic of presentation. So I request Marc Pelletier to give his initial talk.
Thank you very much for that introduction. I'm just going to test whether you can see my screen. Minnie, maybe you can just tell me whether I've got.
Yep, it's all good.
Okay, we're good. We're good to go. So I'm going to take you to the 30,000 foot level of this notion of integrative thinking and talk about the role of leadership with that concept in mind. And what are the tools and techniques and processes that might apply at that 30,000 foot level rather than the individual level. So I'm going to give you some hints, some ideas, and some things that you probably know about already that help with this idea at a system level. So I'm not going to review the idea that chronic disease and particular metabolic diseases and diabetes and type 2 diabetes are big, big, hairy problems. There's lots of questions still to be answered in this disease, and there's lots of possible solutions. And so the challenge, of course, is trying to dissect and organize and think through these problems, not only at a clinical level or an individual level, but really what does that look like at a system level? And what is the role of leadership, broadly speaking, clinical leadership, administrative leadership, policy leadership in advancing this cause, all with this idea at the core that we understand complex problems much deeper now, and integrative thinking helps with understanding that complexity vis-a-vis at the individual level. So we're going to explore this a little bit deeper vis-a-vis a systems mindset or an integrative thinking at a management or leadership level. Excuse me. And the first tool that some of you might know about is actually from the World Health Organization. And it is the notion of the partnership model, the pentagram partnership model. And here in British Columbia, it's widely used and increasingly so as people start to see how it fits in their world of leadership and management. And one organization that we partner with is the Rural Coordination Center of British Columbia. And they're focused on the rural population, the rural delivery of healthcare. And they've done some really cool work. We follow their work closely, we partner with them. And they've added a little plus sign to the pentagram partnership concept, and I'll get to that in a minute, but I think it might be relevant to be more inclusive when you add this little plus bit. So the pentagram model is fairly straightforward. It really just kind of says all these big hairy problems to get movement ahead, to get movement forward on this notion of optimal health at an individual level or optimal health system performance. It has to start with this concept of needs at the core. It can't be frivolous, and it can't oversimplify the need for a solution. So you have to start with this idea that many of these challenges that we have, and particularly in chronic disease, have to have responsive, complex solutions. So this pentagram partnership really just answers the question of the who. Who should be around the table when you start to explore this issue, when you start to try to figure out where to go from here. And so policymakers, fairly straightforward, but sometimes difficult. We often have meetings and discussions and critiques, and we often finger point to, geez, it's the policymakers that are not perceiving this. When you have a meeting that you don't have the healthcare providers in the room, the administrators will point to the clinical people who aren't doing the great job, or the researchers haven't generated the right kind of evidence, and so on. So by having people around the table from the beginning has an important feature. So it's in diabetes in particular, type 2 diabetes, we've approached this with that in mind, that we've really brought forward this idea of these main partners. Now, I'll just run through a couple of the features. So the whole idea that these features of the pentagram partnership are not necessarily the only main partners, and there will be subsets of these partners that you need to consider. So it has to be contextually aware, and it could be scaled. It could be scaled at the country level, it could be scaled at the provincial level or the state level, it could be scaled at the community level and the neighborhood level even. Do you have the right people around the table? So it really is about this idea of harmony. It's really about this idea of balance, not of representation. This is a key feature of the World Health Organization model. It's not necessarily about representation, but it is about bringing perspectives, and as many perspectives as possible. So you have perspectives in the room, and sometimes you might have the wrong perspectives or the perspectives that don't necessarily help advance the conversations. So balancing the perspectives is important. So having insight and where those perspectives might come from. And so being aware of those notions. But the failure of some models is to politicize it and think about representation. This organization of clinical providers, or this organization of leaders, or this organization of managers think they need to be representative of their organization. While that may be true sometimes, what we do want are people with insights to bring that balance of perspective. So you may ask, like I said earlier, what is this plus sign? What is this all about? And so if you start with that basic model, you'll end up with a couple of other options. And you can include this idea of organizations. So researchers are the core of what the perspective we want to bring relevant to the topic. But sometimes research organizations, including other research networks, for example, might play a role, or provider organizations may play a role. There's sometimes a big history, a big knowledge base that needs to come from provider organizations, not just providers. So the purpose of the plus is to allow for a little bit more depth in the idea of the pentagram. And one example that's relevant to the type 2 diabetes diagnosis, but chronic diseases generally, mental health and so on, is the inclusion of employers, and employers playing an increasing role in achieving balance in people's lives, right? This whole idea of workplace balance or work personal life balance. So employers play a big role given that the amount of time that you spend at work. And more providers, progressive employers, are bringing to the table offerings around health, around high quality workplaces and so on. So their perspectives might be really relevant in terms of the broader solution and supporting people's health, supporting their challenge of navigating the system, supporting access to services, but also as they begin as key players to be bringing that perspective of the integration into their world. That's not just about producing, but it's about actually having healthy people at work. And of course, there's business reasons that they would pursue that, but that would be one example. The other example of communities really is coming to the fore in the recent months, in particularly in Canada, related to First Nations communities. There's this awakening, a really healthy awakening of bringing community to the table, and not just for representation, but this idea of truly an exchange, truly learning from the perspective. And this conference is one fantastic example of really starting to understand the South Asian communities, the multiple layers of communities, the features of those communities, and the history, the deep history that they can bring to the conversation. So the richness and the value that can come from this pentagram partnership cannot be underestimated. And I think it's imperative and critical for leaders across the system, not just in healthcare, but across the system and in many different aspects of our lives, to be thinking about that. If we really want to make a dent in this challenge of chronic disease, we need to be thinking an integrative way, and the leaders have to be thinking as an integrative concept. So this notion has been summarized in many concepts at a clinical level, is nothing about us without us. So the whole idea of engagement of patients, for example, the engagement of communities, without nothing about us without us. So it really embodies this whole idea that we proceed with this notion in mind. The second concept that I wanted to link to this is something that's evolving in the organization of health service delivery, in the organization of service delivery across the globe. And this is this idea of networks. And we in British Columbia have established a type 2 diabetes network, a province-wide network, to try to advance this concept of the pentagram partnership, or to be facilitating discussion in the pentagram partnership. And what was the spark of our type 2 diabetes network, why we focused at IHSTS to facilitate this, was two really important ideas, I think, that are really positive and encouraging and hopeful. One of them is this idea that this type 2 diabetes, and perhaps a lot of other chronic diseases, are largely preventable. And we sort of know that intellectually. We know it in our practices, both leadership practices, management practices, and clinical practices. We kind of know it. But as alluded to, we haven't been that successful at bringing that to the fore. In other words, more and more people, as the population ages and grows, more and more people have type 2 diabetes. So we're not that successful, to be completely frank, with prevention. But we do know that up to 90% of type 2 diabetes, broadly speaking, is in fact preventable. And there's a whole stream of thinking and work that we're trying to advance in that space. And I'll speak to a little bit more in the context of policy, bringing this notion of population to the fore, population health to the fore, to policy leadership to the fore, as a key factor at a population prevention level. And secondly, at the idea of clinical prevention, and the whole idea that more and more can be done, broadly speaking, clinical, not just in the context of family physicians or in specialist physicians, but across the board in points of contact with the system, is to be thinking right from the beginning that type 2 diabetes is preventable. The second really energizing idea that we presented at previous conferences, and you'll hear more about it this morning, is in fact type 2 diabetes is reversible. And that's a shocker to a lot of folks. It's not really part of the mainstream dialogue at this point across the board, in professional groups, in the general public. And in fact, it's a very sad statement that many communities still believe that type 2 diabetes is in fact a progressive chronic illness. The idea of reversibility is not even in the conversation. So those two ideas are just opposed as concepts that have launched our type 2 diabetes network, given it energy and given it purpose. So,
Marc, I hate to interrupt. Just want to know how many more slides that you have. We're getting a little short on time, and we do.
Okay, I've just said what I needed to say. So we've on the type 2 diabetes. So another 30 seconds here. So this is what we've been doing, is building this facilitated network across the board. It's still in its early days, and I can talk to you more in the question and answers. The last concept I would emphasize is the learning health system. The networks that facilitate exchange will accelerate learning. The deeper and broader exchange will facilitate deeper and broader learning, and surface deeper and broader solutions. So without this idea of a network, without this idea of a pentagram partnership, you could easily go down a rabbit hole and think, boy, if you just fix this drug, you're going to solve the solution. You're going to have a solution. And lastly, the learning concept is that there are many, many solutions already in play. And this is this idea that we have to build on those as opposed to reinvent. And we found that in type 2 diabetes network in British Columbia, that there are many, many solutions. And as we broaden the conversation like we're doing this morning, we're going to find more and more solutions in play. And as Kathleen Ross just noted, boy, there's some really cool stuff happening here in British Columbia, and it's a matter of surfacing it, facilitating the sharing, and so on. So thank you very much. I'm going to turn it back to Minnie for comments or questions.
Thank you. Thank you, Dr. Marc. I think these concepts certainly are going to make a big way forward, and these are going to help us in actually bringing multiple approaches. And as truly we say, integrative thinking certainly requires not just with healthcare policy makers, but also involves multiple other angles. So do we have some time for questions?
We do have one question here, so we'll get this
on.
one in. This is a really great model, and I think it resonates with a lot of people. And Marc, you know, myself, my passion for community and patient engagement, so I was really happy to see that there. How do you see this this leadership model applying in pandemics, when we're like fighting COVID, when we have to respond like really quickly to the environment? Any thoughts on the model in that context?
You know, it's interesting, Minnie, that where networks existed, where facilitated relationships were already in play, that were positive, there seems to be a route to success in terms of ongoing management, ongoing communication. So it builds on the strength of network and the importance of network. And there's lots of stories, I think, that will evolve on the idea of network. So the absence of a network, the absence of a strength in understanding these different perspectives, including the idea of community, are some of the roots of, you might say, a weakness in response. And one of the good examples in the South Asian community in British Columbia is there was a faltering of good communication with the multiple languages, the multiple cultural adaptations, particularly in South Fraser or Surrey in British Columbia, where there's a high concentration of South Asian population, but right across the board, whether it's First Nations communities and understanding that culture. So again, the missing on the pentagram partnership might be the root cause of where we might find weakness in response, but also we would find strength. So, you know, let's turn it around and say that where we have a strength in, first of all, this mindset of leadership, that we need pentagram partnership as a mindset across the board. We need networks to facilitate that pentagram partnership across the board. And of course, we need human-to-human connection, human-to-human partnership that facilitates those exchange, that communication, and that insight. But there's been some fantastic learning in the research community as it informs the response. And there could be strength there, building relationships, and so on. So I think there's a lot of applicability. And I would say all those big, hairy problems that we face need this base. And that's the beginnings of an integrated leadership mindset.
Perfect. Thank you.